Hi, my name is Veronica Santillan, and I'm going to talk about herpes labialis and facial nerve paralysis. I'm a student of nursing in the University of Católica. Well, the definition is an infection of the mouth area that causes small, painful blisters to develop on the lips, gums, or throat. These blisters are caused by the herpes simplex virus, a common and highly contagious virus. There are three stages of infections that occur in oral herpes, which include the primary infection, the latency period, and recurrence during the initial stage of infection. The virus enters the skin or mucosal membrane, where it then reproduces. Blisters and other symptoms such as fever may develop, although the virus sometimes doesn't cause any symptoms. After primary infection, the virus lies dormant inside the nervous tissues of the spine, where it reproduces but remains inactive. Later in life, the virus can reactive, particularly in case of emotional or physical distress, and lead to the development of future sores and symptoms. The nursing application provide cold compress to the patient to help relieve discomfort. Recommend the consumption of cold drinks and cold foods to have less discomfort. Give the patient acetaminophen or ibuprofen to relieve pain. Giving aspirin or any other medicine containing aspirin or other salicylates is prohibited because it has been linked to an unusual but serious illness called Reyes syndrome. Also, give antiviral tablets like aclovir, famciclovir, and valacyclovir. These antiviral agents are more effective if they are taken as soon as symptoms first present and before the blisters first appear. However, these medications cannot cure oral herpes, and it is still possible for the patient to spread the virus to those around them.
Hello, this is Dr. Ben Benham. I'm a board-certified dermatologist, laser and skin cancer specialist. Welcome to our educational video. Today we're going to talk about cold sores. Cold sores are caused by a virus, which is actually herpes virus. And the way that patients get cold sore, it is transmission of basically saliva from one person to another person. Most people actually in the United States, over 65-70% of all people in the US have cold sores. The fact that a lot of them are not walking around with something with a blister around their mouth is because most of the time the cold sore is just sitting there. The herpes virus just sits in the nerves and doesn't do anything. At times of stress, basically it could come out. So, first of all, what are the most common ways of preventing an occurrence of a cold sore? The most important thing is to wear sunscreen around the lip area. If you're going to be out in the sun for a whole day and you have a history of cold sores or herpes around the mouth, the sun will cause the sore to come out. So wearing a lot of sunscreen basically will prevent a flare-up. Also have patients that, for example, they undergo surgeries or are under a lot of stressful situation, and stress basically will allow the virus to proliferate and basically form a sore around the mouth. So how does a cold sore look like? So cold sores, first are typically painful and they're tingling. So patients describe this tingling sensation a couple days prior to the lesions coming out. It is tender to touch. They're typically the group of clusters of vesicles basically add the angles of the mouth. We could also get it on the upper and lower lips as well. And then basically they crust over. The first initial of cold sores could be very severe, and they could include lesions inside the mouth as well. How do we treat it? The most important thing is to actually start taking an oral medication called acyclovir, or its brand name called Valtrex, literally immediately as soon as you feel this cold sore basically coming on. With Valtrex, I typically prescribe 2 grams. You take it in the morning and 2 grams you take it at night and you're done. The sooner you take it, the faster it's going to heal, and the less visible it's going to be because you're not going to have the crusty lesions around the mouth for like 10 days. Again, this is Dr. Ben Benham. I'm a board certified dermatologist. Thank you for basically viewing our video. If you have any questions, feel free to give us a call at 310-315-4989 or visit our website for other educational videos, santamonicaskin.com. Have a nice day.
Pros and cons. Pros: extensive clinical experience, high transgene expression levels. Cons: immune response to viral proteins, unknown action of many genes, potential cytopathic effects, and side effects including serious diseases. Issue apply in Ecuador. In Ecuador, according to the INEC report, 224 people entered health homes with herpetic infections. 15% were men and the rest women. That year, a total of 1,092,749 people were admitted to these health centers. The most common treatment used in Ecuador is acyclovir and Sovirax. They are creams that are easily found in any pharmacy in the country without the need for a prescription.
Hello, I'm Dr. Anirudh. I'm a dental surgeon at Toothpicks Dental Healthcare, Jayanagar. Herpes labialis is an acute infection. Acute meaning to say it is a sudden onset of an infection, which is generally caused by herpes simplex virus. It's a viral infection basically. So the blisters are generally seen at the corner of your lips, especially here. So it's the labialis. The labialis turning to the lips, around the borders of the lips, you get to see this kind of lesion. However, this lesion can spread because of close contact, because of kissing, because of sharing a water bottle, sharing cutlery, sharing a glass or a tumbler. So this is one of the reasons why it can spread. However, it is very important that we understand how the disease spreads, because that is how we could possibly control it. It is seen throughout the year. It is not specific to a particular season or a particular time of the year. It's seen throughout. It can last from anywhere between 7 days to around 25 to 26 days. Generally, extensive treatment for this condition is not required. Just precautions not to spread it to others, and precautions should be taken before treating the patient so that we don't disturb the lesion. However, it is always better to diagnose this condition in the clinic. It's important that your doctor diagnoses it as herpes labialis, because herpes labialis kind of an infection, the kind of symptoms can be manifested because of other lesions. It can be bacterial, it can be because of some systemic condition like fever or other things. Therefore, don't diagnose these things by yourself. It is important that a doctor, dentist diagnose this.
Facial nerve paralysis. Definition: is an inability to move the muscles that control smiling, blinking, and other facial movements. These conditions can affect a person's ability to convey emotion. Most of the time, facial paralysis is limited to one side of the face. Paralysis can occur if any part of the facial nerve, called the seventh cranial nerve, becomes inflamed or damaged. The facial nerve has branches throughout both sides of the face and controls many muscle groups, including those in the brow, eyelid, cheek, and lips. A person may also experience paralysis if the area of the brain that sends electrical signals to the facial muscles is damaged. Nursing application. The nursing application staff will implement a care plan that will include the 3 surgical periods: preoperative, that is collect all the data inherent to the pathology that the patient presents and that are crucial for its therapeutic management; intraoperative, nursing staff must verify the preoperative preparation of the patient and the clinical history, collaborate in the transfer of the patient to the surgical table, placing him in the indicated position, cooperate with the anesthetist throughout the process, monitoring vital signs, administration of drugs, and paying special attention to possible reactions and/or complications. Ensure correct asepsis as well as implicit measures in any surgical process. Apply a compression bandage to the eye from which the graft sample is extracted. Post-operative, help the patient with his facial muscular reduction, wrinkling the forehead, opening and closing the eyes, smiling, wrinkling the nose, lifting the upper lip, and pressing the lips.
The facial nerve starts from the brain, travels in a long bony canal before coming out of the skull and passing through the parotid gland to get to the muscles of the face, thus controlling facial movement and expression. Once the facial nerve enters the parotid gland, it generally divides into 2 main branches called upper and lower divisions, and then into 5 other branches, which then subdivide into many smaller branches that connect to the facial muscles. Facial nerve branching is like a tree in that no 2 facial nerve branching systems are the same, and great expertise is required to be able to dissect the nerve, find all the branches, and protect them.
Pros and cons. Pros: I believe that there is no advantage to this. The only good thing is that there are treatments. Cons: irreversible damage to the facial nerve, abnormal new growth of neurofibers that cause involuntary contraction of certain muscles when trying to move others, partial or total blindness of the eyes that doesn't close due to excessive dryness. Issue apply in Ecuador. In Ecuador, this incidence is 20 to 30 cases per 1,000 people a year. There are many treatments that are used here, such as the use of physiotherapy, acupuncture, and microsurgery that was recently included in the Equator. Many technical universities have specialized in thoracic investigating this pathology.
I'm Beth Robertson. I am the neurologist on the facial reanimation clinic team, and it's my responsibility to do the neurologic evaluation. This might consist of just the exam. In some cases, it involves evaluating for why the patient is weak. The facial nerve is a nerve that comes from the brainstem out towards the facial muscles and controls the muscles that are used for facial expression. So smiling, closing the eye, raising the eyebrows. And sometimes that can be weak when we're born, and sometimes that can be weak from tumors of the brain or the nerve. Sometimes during surgery, either surgery around the gland right here, the parotid gland, or surgeries around the brainstem, sometimes that nerve can be cut. And so we see patients from all ages, children to older adults, and we try and help patients where that weakness is permanent or at least has not recovered fully. And so our team has come together to try and figure out how we can help restore those facial expressions. And one of the things I really love about working with this team is that everyone on the team, the ophthalmologists, the optometrists, physical therapists, the plastic surgeons, all seem to share the same passion for helping patients with facial weakness. And so each patient's case is unique, and we go over the case in great detail, sharing our expertise, trying to decide the very best procedural options to take care of that patient. Sometimes that involves surgeries that maybe haven't been done before or are on the cutting edge, but we discuss them in great detail, and we all really love working to help our patients. I'm Beth Robertson.
Conclusion. Definitely one of the satisfaction of nursing staff is that the people graduate in better conditions than when they enter. knowing that the applied care process helps us to identify the needs of the people, and these serve to manage the diagnosis. The goal of any profession is to improve the practice of its member and for nursing to provide service to the person more effectively. For these reasons, as nursing professionals, we must not worry about acquiring or having a better education, that is, preparing ourselves to correct all deficiencies in order to be prepared for everything and in this way carry out our interventions correctly. The two previously mentioned diseases are not a game and can put the patient's life at risk. It is our duty to help them and ensure they have a better living condition. Thank you very much.